name the song?
You've named the last two.
Hollywood. Gosh darn it.
Don't you think but just right?
Yeah. Is that it?
All I said is there's a bit of that.
Big Biz Show rolling on here.
Got it.
Loft 100 Studios. The whole gang's here. And the DTT. Okay.
Greg, you and I have talked about James Sapirstein a lot off the air. This guy is when we were in COVID, and everybody's like, yeah, you're fine, take off your mask. He was the go-to guy that looked at the top down and said,
Yeah.
hey, wait a minute, back that truck up,
Yeah.
pull it over on the 411 highway, and let's figure it out. James Sapirstein is the CEO, chairman, and president of a company called First Wave Biopharma. Interesting enough, I interviewed this company with another CEO when it was called, I think it was called Azurex, and James was the chairman. But James wrangled this thing and has done a great job of pivoting all the way from COVID back to biotech pharma in so much. I can't, what is the name of the James? I'm going to ask you.
Yes.
What is it? Multiple sclerosis, or is it? What's the disease that where these guys are taking 45 pills a day, and now they're taking 2 pills a day? What is the disease you're?
So you're thinking about cystic fibrosis.
Cystic fibrosis.
Yes.
Now let me ask you that. This is not a cure, but it's a quality of life issue, right?
It's a treatment, I'm happy to say, we're getting ready, on the report and having to go back to the FDA. I had top-line data in July that showed we didn't reach a clinical endpoint, but we're getting there to fixing that.
But what's interesting is that if you think in terms of how your company has evolved, you are constantly looking for new therapies to address. You have a hitch in the giddy up there with the top line clinical data, and now you're still going. What are you guys working on now?
Well, so with Drulipase, which is what you mentioned for cystic fibrosis patients, we absolutely know that we can get the job done within 5 to 8 capsules. So that's the good news. The formulation turned out to be a better formulation. So at this point, we're putting together all our data. Stay tuned for that. But in September, just last month, we licensed in from Sanofi a product called Capicerod. And it's a product that's been studied in 600 patients already, but for Alzheimer's disease. And Sanofi is no longer in Alzheimer's disease, but one of the things they discovered is in these 600 patients that the drug had an effect on gastrointestinal motility, or just how peristalsis works. And we licensed it in to look at gastroparesis, which is a very large indication, and a smaller indication called pediatric ulcerative colitis, which is an orphan indication. So we're going to start working on that very soon. We're doing all our tech transfer work with them now, and then stay tuned. I hope to have a big announcement coming up soon.
Hey James, I have a question about biotech firms in the public market. There's no revenue. You are betting on your scientists. How do you guys survive? Is it just raising capital over and over again? What is the model there?
That's the question of the day. I just came back from San Francisco last night. I was at an investor conference, and we're talking about our information, our data, and we get small investors to come in and invest in our company. My first company that I was part of selling was Tabira Therapeutics, which I co-founded with Domain out of San Diego, actually, and we sold that for $1.7 billion to Allergan. So the investors had a 43x.
I have a different question.
So that's really what people are counting on, is getting a high return on their
You
investment.
got COVID, Mike, or you want me to do it?
James, I have to tell you this. We love you and your company, and we talk about it even when you're off the air. But you have become the resident COVID expert here since 2020, when Mike was shaking like a dog pooping peach seeds. So
It's pits.
I have a question for you. So we went from pandemic, and by the way, we didn't know what we didn't know, right? Like, and the government, who we all were pissed at, was doing the best they could, or the best they could muster up. And suddenly we get to the point where, hey, look, we're into the endemic phase versus the pandemic phase. And then suddenly I'm scrolling through utwitface.com, and I'm seeing all of these comments about there's a new strain. But hasn't there been a new strain every 6 months since I got my 7th vaccine? Where are we at now in terms of COVID in the U.S., and how are we doing?
Well, look, it's going to keep mutating. And that's really what the virus looks like to us. And
Thanks, James.
the vaccines will just try to stay ahead of it as best they could. So, but I'll stand by my guns. I think it's a yearly vaccine, just like the flu vaccine. And hopefully you won't see too many more hospitalizations this winter.
Are we at the point, can we throw herd immunity, that phrase, out the window?
No.
I mean, will we ever get that, or is that we're still striving for
If
it?
you look like a bovine.
Oh, I'm going to get you.
I think we have it to a certain extent. I don't think you can throw that term out the window. Less people are dying of COVID, even with the new mutations. So I think everyone's got a pretty good baseline of immune response. So, I think we're there with herd immunity, but you're still going to have mutations and new infections.
James, do you think that there are treatments being developed to assist with the long COVID issues? Is that something that people are working on?
That's a great question, because there's people from 2020 who have COVID
man.
that still have
that are
COVID.
still so sick,
yeah.
or have developed other random
Still can't
diseases
taste
or
anything.
or autoimmune diseases.
And of course, me, Greg, and Mike forgot about those people. Allison.
So I'm just curious if there are things are in development to assist with that, because it seems like people are that there's a large population really suffering.
I think there are products being developed for the symptoms behind long COVID, but I don't believe we really have an answer in terms of what causes long-term COVID. So once that's figured out, I think they'll start developing products targeted that. Think about the last epidemic that we had, which was really HIV, right? Or even the bird flu, but HIV specifically. It took 15, 20 years to figure out on a cellular level exactly what's happening with the HIV virus, and there are treatments to hold it off. It's still not an HIV vaccine available, but I think I stay tuned. I would tell you within 2-3 years you'll probably have something that's pretty good for long-term COVID.
If you were in college in 1980 to 83, and they announced the HIV pandemic, you were shaking like Don Knotts. And, and I was down with Magic Johnson down to Haiti. I'm thinking, you only come to Haiti one time. Let's live it up. Sorry. Hey, James, I have a question for you. So the flu vaccine, it's kind of a crapshoot, because if I get a flu vaccine and my doctor says, buy straw hats in the winter, so get your flu vaccine in July. So if I get a flu vaccine, it may not be the same strain. Is that the same thing for COVID?
Not necessarily. So this new mutation that was really discovered earlier this summer, like in June, I think the current vaccine will cover for that. If there's a completely new mutation that happens over the winter, then that vaccine will be useless. But I don't think that'll happen. I think what we've seen in the southern hemisphere, that this current vaccine will cover for that.
James, thank you so much. James Sapirstein, President, Chairman, CEO of First Wave Biopharma.
I always feel so much better after talking.
Or sometimes you don't.
Well,
sometimes
maybe
you don't.
not, but
Right.
Sometimes you don't. Big Biz Show. More coming up. Stay by.